Good morning. I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's media availability. Spanish interpretation is available on ATXN 3. To start, Dr. Desmar Walks, Austin Travis County Health Authority, will first say a few words, followed by Interim Austin Public Health Director Adrian Stirrup, then Janet Pichette, Austin Public Health Chief Epidemiologist, followed by Cassandra De Leon, APH Chief Administrative Officer for Disease Prevention and Health Promotion Division. We will then open it up to our pool reporter who will ask questions on behalf of the media. Dr. Walks, over to you.
Good morning, everyone. We've had several deaths this past week with 36 individuals passing, and I'd like to take a moment of silence to reflect on our neighbors, loved ones, and friends who have passed, and to think and pray for those who are struggling to recover from COVID-19. Thank you. We now know that the Delta variant is a very different variation of the virus SARS-CoV-2, and it has impacted our community hugely in these past few weeks. We've surpassed previous spikes in new cases. We're starting to see those cases plateau and drop to some extent. But we're also seeing a lot of people still in ICU, and we're seeing a lot of people die from this. Recently, we've heard reports in the news of the parents of 4 children who both passed from COVID-19. And we want to take this time today to really urge those of you who are planning to socialize and get out of town for this holiday weekend to continue to do what you need to do to protect yourselves, your loved ones, and your family from getting COVID-19 this holiday weekend. Wear a mask, socially distance when you're in crowds of people that you don't know. Please wear a mask. And if you haven't been vaccinated, please take the time to do so. We're seeing more individuals who are younger, unvaccinated, die from this illness who are perfectly healthy. And we really want to stress the importance of getting vaccine at this time. And with that, I'd like to pass it to Director Stirrup.
Thank you, Dr. Walks. It's a sobering moment to realize that we've had 36 people die unnecessarily from COVID in the last week. And it's hard for me to celebrate the progress that we're making. You know, all of the numbers are showing that we are moving in the right direction. But those deaths weigh heavy on my mind because there's so much that we can do. The virus is changing and adapting. And we don't have to. We know what works. We've proven it. Masking, social distancing, avoiding large crowds, washing your hands, staying home when you're sick. Those are the things that we can continue to do. And more importantly, being vaccinated. When we are vaccinated, we give the virus less opportunity to replicate and for other mutations to come on the scene. If we want to go back to normal, it starts with this. Here's my cute little bee to make it convenient for me, right? So these are the things that we need to do as a community. And we're going to continue to come back and tell you that week after week until we reach the place where we have successfully protected our community from COVID-19. With that, I will pass it to Janet Pichette.
Good morning, everyone. As we head into the Labor Day weekend, I wanted to mention 2 things. One, September marks the beginning of National Preparedness Month. And while you begin to take an opportunity to celebrate this weekend and rest up, I really do feel that you also should be considering self-care and preparedness for you and your family. And those are doing those things that are going to protect you from COVID-19. So if you are traveling out of town or participating in large gatherings and events, please be prepared, wear a mask, socially distant. As Ian mentioned, do those things that are going to protect you and your loved ones. We don't want to see any other preventable deaths occur in our community. We want our communities to be safe. You know, if you're sick, take the time to stay home and recuperate and rest. Consider getting a test if you're having symptomology that is indicative of COVID-19. So, you know, what we found over the last week as we are continuing to investigate a large number of cases that we're seeing is that masking works. And, you know, it's been debated over and over, but we are seeing in school districts where masking was implemented a much lower incident rate of COVID-19 among students and staff than those school districts where masking is not occurring or masking is optional. So do those things to prepare yourself and place you in a better position. Mask up, get vaccinated, socially distance, avoid touching your face, and just keep yourself out of harm's way and enjoy your weekend. And I'll turn it over to Cassie.
Thank you, Janet. And I just want to reiterate again, it is very unfortunate as a public health official and as we work through this pandemic to continue to see individuals suffer and to continue to see individuals succumb to this disease. Unfortunately, many of us have been touched personally, and there is a lot that we are working through just to continue on. This disease is devastating. It's devastating to those families that are losing parents, those companies that are losing the head of their company, and other coworkers. These are things that we never imagined could happen. And unfortunately now we're seeing parents having to deal with their own children being affected by this virus. We do have tools to help protect each other. And as we move forward, we are doubling down on just encouraging those to use those infection control measures. Regarding vaccine, for those that can get vaccinated, we know that majority of those that are suffering in the hospital and that are unfortunately passing away from this disease, majority are unvaccinated. So we know that that is an important tool to give a layer of protection against this virus. Austin Public Health continues to focus on that unvaccinated population. And I want to give a huge shout out to school districts that have hosted clinics at sites to really make sure that there's those cones of protection around for their staff and for their eligible children to get vaccinated. Leander ISD, for example, hosted a clinic with Austin Public Health, and we vaccinated over 100 individuals just this week. And then I also want to give a huge shout out to our vaccine strike teams. We know that many of those who are still unvaccinated just haven't been able to get to those clinics. And that's an example of, we've got a large population of homelessness, of individuals experiencing homelessness. This week, we had incredible stories of our strike teams going into homeless encampments, particularly under a bridge downtown in Austin, Texas, where there were 30 shots administered to those who may have had no other way to get to a vaccine clinic. And that's public health at its best, where we go and meet people where they're at. Our hope is that as we continue to vaccinate individuals, that we can continue to contribute to flattening the curve. We as individual citizens and residents of this county, all of those infection control measures also contribute to that. We have an individual responsibility, and as Austin Public Health, we'll continue to meet our responsibility of giving you all the protection we can. And with that, I'll open us up for questions.
Thank you, Cassie. At this time, we will now turn it over to our pool reporter from Univision, Karame Hernandez.
Good morning, everyone. Happy Friday. I'm going to start with the first question from my station. What recommendations do you have for school-age children if they will be traveling this weekend as far as returning to school goes?
Oh, you want to start, Dr. Watts? I can go ahead and start. For anybody who's traveling and in general, you need to wear a mask, especially if you're on public transportation. You need to avoid crowds and social distance, and you need to be aware of what laws and recommendations are in the destination locations that you're going to be visiting. If a child and family members are fully vaccinated upon return after travel, they need to self-monitor themselves for symptomology. And if they begin developing symptoms, they need to consider getting tested as soon as possible. If individuals are not vaccinated, they should get a baseline test before they travel. Some locations are requiring a negative test, but a negative viral test before traveling to some locations. Again, they need to, when they return from travel, they need to consider, or they need to get a viral test 3 to 5 days after their travel, and they need to continue to quarantine for a 7-day period. If they choose not to get a viral test after return from travel, they need to quarantine for a 10-day period. So even if you have a negative test after your return from travel, you still need to quarantine for a full 7 days.
I would just add to that, thanks, Janet, that when you come back from travel, and if you've been traveling anywhere in our country in particular, we are all at all parts of our country experiencing high levels of community transmission. So it's important that if you are coming back home and you're going to be around loved ones who have compromised immune system, that you protect them by wearing a mask, regardless of whether you're vaccinated or unvaccinated, so that you can protect them from developing COVID-19. And that also applies to children who are under the age of 12 and unable to obtain vaccination at this point.
Next question from CBS Austin. Last Labor Day weekend did not turn out to be a super spreader holiday. In fact, it had little impact on cases and hospitalizations. Do you think this Labor Day will be different, and why?
We're going to have a different outcome this time because last year school was not in session and we were dealing with a virus that was not the Delta variant of COVID-19, which is much more transmissible. We're going to have a different outcome this year because we have vaccines in place and we have certain individuals who are unvaccinated. So it's important that everyone wear masks if they're indoors, and if they're outdoors in places where they're unable to effectively social distance, masking is going to be important so that we do not increase our numbers. And that particularly goes for places where you're going to have your mask off because you're eating and socializing, like tailgating parties. So it's really important that if you're unprotected by vaccine, that you avoid situations where you put yourself in danger of getting COVID-19. And if you are going to be in a situation where you're going to be in crowds with people that you are not living with and are unvaccinated or unknown, we don't know what their vaccine status is, that you wear a mask and socially distance when possible.
And I'll go ahead and add that, differences between last year and this year. One thing that isn't different is our message. Our message is to, as Dr. Walks mentioned, wear a mask, make sure you're doing all that you can to protect yourself and your loved ones, socially distance, if you're gathering, avoid crowds and things like that. I mean, differences, we're much more open than we were last year, where there may be more people congregating in situations and that type of thing. We don't want it to be a super spreader event. The potential is still there. So if we want a repeat of last year where we don't have a sharp increase after a holiday event like this weekend, we need to make sure that we're doing the right things. The difference this year, we have vaccines available too. Go ahead and get vaccinated. Take the time this weekend to do what you can to protect yourself.
Next question comes from the Austin American Statesman. Austin and Travis County recorded 12 new deaths from illnesses linked to COVID-19 yesterday. Did 12 people die on the same date, and what accounts for the number fluctuation?
We're in the middle of a surge right now, actually, and so we are anticipating that with the development of cases, hospitalizations, transfer to ICU admissions, that we will have people who succumb to COVID-19, and in particular the Delta variant, because it causes severe disease and is more transmissible. And so the deaths and the numbers of deaths that we're seeing right now are a result of the fact that we are in a surge, and our ICUs are full. We have several people on ventilators, and at a point when we think they may survive, at usually in a 3-week time frame after onset of symptoms, they may come off of vent and be fine, but in other instances, they don't make it. They have an event that causes them to die. This is the natural course of this disease, unfortunately. And unlike last year at this time, when we were not in the middle of a surge, when school was not in session, children weren't in close contact, not wearing masks, we did not have the number of cases that we do right now in our ICUs and with the number of people on ventilators. But we do now, and that's why we're seeing the number of deaths that we're seeing. And yes, all 12 people died on one day, and that's unfortunate.
Next question comes from KXAN. In a briefing earlier this week, Dr. Walks showed only 9% of the community being vulnerable, 10% partially vaccinated in a progress to herd immunity report. Does that mean we're already at roughly 80% immunity, and how far away are we from herd immunity?
When we look at our herd immunity calculations, we're doing that based on the entire population of people in our county. And so we are actually only at 58% herd immunity for the entire population. When we look at the number of people who are eligible for a vaccine at this time, those who are 12 years of age and older, we're at 67.5. So that's the difference. And we'd still have a large segment of our population under the age of 12 who are not eligible for vaccination. So it's important that we protect them by wearing masks.
Next question comes from Austin Chronicle. According to data tracked by the Texas Department of State Health Services, about 67% of Travis County vaccine eligible population is fully vaccinated. The local goal is to have 70% of Travis County population fully vaccinated by Labor Day. How confident is APH that we'll reach that goal?
We are hoping that we'll continue to see folks get vaccinated throughout the weekend, and we'll get closer and closer to that goal. It is something we really want to see. It's a little over 20,000 individuals that would need to get vaccinated, but we hope that folks will take that opportunity and get the vaccine. Austin Public Health has our clinics open today and tomorrow, as well as many clinics throughout the community has vaccine available. So we really want to encourage folks to get vaccinated and to be able to have that full protection from this virus.
Next question, we're gonna skip KVU. They don't have anything. We're gonna go with KUT. Is APH concerned that Saturday's UT football game at home with a full stadium and no mask requirement will be a super spreader event?
I'll say that anytime you have a situation where you have a congregation, a large gathering, queuing up in as they enter a stadium, exiting the stadium, there's always a potential for increased disease transmission in those scenarios. And so, yes, I am concerned that it could lead to unnecessary exposures if people don't take the right precautions.
There is concern when there are large gatherings of people who are a mixture of unvaccinated and vaccinated individuals. And that is why we have recommended masking for everyone in crowds of people that are not living together in one setting. We've asked for masking because it does stop the spread of COVID-19. I would urge those who are going to the game to check yourselves by testing yourselves. If you feel like you have any symptoms that you think might be allergies, go ahead and test yourselves. And if you're sick, stay home. If you're positive, for sure, stay home and seek medical attention early so that if you are qualified for monoclonal antibody therapy, you can go and have that done. The tailgating parties are the places where we're really, really concerned that there may be some transmission, because those are situations when people will be close together in close contact, congregating, likely unmasked, and for long periods of time. So if you're not protected by vaccine, or even if you're vaccinated and you have any comorbidities that put you at risk for severe disease from COVID-19, you should avoid those situations. We want this to be a successful game for our UT fans, but masking is really going to make a difference. And people staying home if they're sick is going to really help to make this a success for the team and for us at Public Health, because we don't want people to get sick, and we'd like to see it be a good experience for all.
Thank you. I'm about to start reading the second question. With kids back in school, do you have a plan for possible flu outbreaks or respiratory illnesses that we tend to see during the fall?
So I'll answer that question or start off with that. So every October in the city of Austin and Travis County and throughout the state marks the beginning of flu season. And during that time period, local health departments are responsible for beginning the surveillance of flu and influenza-like illness. So we do have a plan. It's something that we've had in place for many, many years, and we work with those partners who may have surges or outbreaks in certain specific settings. Not only are we looking at flu in those time periods, but we're looking at other respiratory viruses that may contribute to, like I said, influenza type illnesses that are even similar to COVID. I think one thing we found out from last year was that because we had low number, or people were actually masking, we had a very, very insignificant flu season. And so we had fewer cases than we've ever seen in the time that I've worked at Austin Public Health. And I'm going to attribute that to people taking those precautions that are recommended for COVID. Those are also recommended for all respiratory viruses and help reduce and prevent transmission of disease. And I think it did impact flu season last year.
I would just add that last year as Janet mentioned, we had the lowest number of flu cases on record. And it really is because we did masking, social distancing, and hand washing. This year we are opening school and we're not seeing those practices in place. And it's important that moving forward that we do that, not only to protect against COVID-19, but the flu as well. And in this instance, we have to do masking to protect our children under the age of 12 who are still unable to receive vaccine, and then make sure that everyone goes out and gets their flu shot.
Next question comes from CBS Austin. What is your reaction to the breaking news this morning? The top federal officials have told the White House to scale back plans to offer booster shots in September.
We are following the guidance that we're receiving from the CDC and the FDA, and we will continue to do so and continue to encourage people to be vaccinated and complete the first part of that series, the first and second shots, so that we can protect our community and continue to ask our community to mask, social distance, stay home when sick, and do everything that we can to protect the public health of this community.
Next question comes from the Austin American Statesman. Information has been circulating among communities about a horse deworming medicine being used as a COVID-19 treatment. For those who may not have all the information, why is that treatment not a healthy option?
Ivermectin is a dewormer that's used in cattle and livestock to prevent infections from worms. It is also used in humans at lower doses for other conditions, but it is not approved for the use of treatment of COVID-19. And so the misinformation that's being circulated on social media and internet sites should be disregarded. The CDC and FDA do numerous investigations before they approve medications for use for treatment of COVID-19, and ivermectin has not been approved for that. We do, however, have treatment for COVID-19 that does not require hospitalization. That's something that can be offered to people who are eligible for that because they have a risk of developing severe disease, and that's monoclonal antibody therapy. And we have that available here in Travis County. You contact your healthcare provider and see if you're eligible for it. It's better to have it done earlier than later after development of symptoms. It can be done up to 10 days after the onset of symptoms. And it is something that will reduce the risk for people being hospitalized by 70%. And since August 16th, we've given 767 people IV monoclonal infusion therapy. And that's had a good impact on our current situation in our hospitals and has been able to help reduce the number of hospitalizations. So if you feel sick, get tested. If you're sick, stay home. And if you do have COVID-19, please contact your healthcare provider and see if you're eligible for monoclonal antibody therapy.
Next question from KXAN. Are you seeing increased cases and more serious cases among pregnant women?
Yes, we are seeing more serious cases in women who are pregnant, and there are several complications that occur in pregnancy for women who do develop COVID-19. We've had some women who've had to be on life support and in ICU, and we've actually had some who've had to deliver while they were sick in ICU. So We really encourage women who are pregnant to go and get vaccinated. It is something that's supported by the American Academy of Obstetrics and Gynecology. COVID-19 vaccines are safe in pregnancy and for women who are breastfeeding, and they do prevent serious disease from COVID-19. So if you're pregnant or breastfeeding, please get vaccinated and protect yourself and your baby.
Next question from Austin Chronicle. APH has attributed the recent plateau in COVID hospitalization to behavior modifications, that is masking, staying home if sick, rather than an increase in vaccination. When does APH expect to see the impact of increased vaccinations on local case numbers and hospital admissions?
We're going to see, we are seeing an impact in vaccination rates to some extent from those that have been vaccinated before the surge began. The impact that we'll see from people who are currently receiving vaccines will occur after their vaccines have been fully protective, which means 14 days after that last shot has been received of the 2-shot series. We are hopeful that people will continue the behavioral changes as well. Masking is not only important for those who are unprotected and unvaccinated, but it's also because of the Delta variant's increase in transmissibility and the fact that it's been shown to cause mild or asymptomatic disease in unvaccinated and some in vaccinated people, but it's also been shown to cause some severe disease in those who have comorbidities that make them at higher risk, even though they're vaccinated. So the protection of the vaccine is there, and it is important that we also protect ourselves from spread by wearing masks. So it's not an either or, it's a yes and.
Great. This is the last question from KUT. How many vaccine doses allocated to APH have been wasted because they spoiled, expired, or no longer viable in, say, the last week and cumulative? How successful has APH been in any efforts to limit that loss?
I'll respond. Early on in the vaccine effort, we had to really make sure, because there was such a limited amount of vaccine available, that we had no waste. And we tracked waste to make, and any vaccine that we had, we made sure that we tried to find an arm that was available for that. Later, as the vaccine supply became much more plentiful, the CDC and the Department of State Health Services relaxed those provisions about waste and ensuring that it was more important to vaccinate a person that needed the vaccine than potentially wasting vaccine in the vial that did not have individual arms available. We continue to work, and we want to never have waste whenever possible. But we also know that making sure that the person who is presenting to us and is wanting the vaccine, that's the priority. And so we do track waste. I don't have that figure available at this moment, but that is a figure that we can definitely share how much waste has attributed this week and what we have seen cumulatively. But again, the focus is on getting people vaccine and ensuring that those individuals that waste does not become a barrier to individuals getting vaccinated.
Thank you for that. Now we will move on to our closing remarks. Dr. Walks.
So I'd like to leave you with this thought. We're getting ready to go into a 3-day weekend for rest, relaxation, and fun with our families. Let's do it safely. Let's wear masks. Let's be in crowds of people that are known to us. Stay in our bubble. if you're going to go out, make sure you wear a mask. Try to avoid situations with large crowds of people and areas where you're going to put yourself at risk for contracting COVID-19. It's really important to remember that masks stop the spread of this disease, and crowds where you're close to other people make it really easy for you to get sick. Schools in session, we're seeing so many more cases, 817 more cases last week in schools. Schools having to close classrooms and people in going into hospital and dying, young people dying, leaving their kids without their parents. These are all situations that impact our community and impact our ability to make decisions about what we're going to do to keep our businesses open and our events going. And it's all part and parcel of how we're going to move forward. And we can do it together by the behaviors that we've put in place. We've started masking. We've started to make sure we're not getting out into the community when we're sick. We're wearing masks to protect our children. We need to keep doing those things. The curve's showing us that that works. And in order for us to keep going forward and looking forward to the things that we love to do in the seasons ahead, we're going to have to keep doing those things. So I ask you to have a safe holiday weekend, and you might want to stay out of those tailgate parties if you're not protected by vaccination. Watch the game at home, but have a good weekend.
Thank you, Dr. Walks. From the time we're small, like kindergarten, it's all about learning your individual strengths and talents, but becoming part of a social group. And in every stage of our development, the things that we teach our kids, we teach them how to be leaders, but also to be a responsible part of the collective. We teach them the importance of delayed gratification, making short-term sacrifices for long-term goals. This is the time as a community that we need to enact all of the things that we instill in our children. If we're talking about modeling for our children, this is the moment we model and protect. And so the short-term goal is masking stops the spread. If you feel you need to be out in a social gathering, please wear your mask. Vaccinations protect us long term. So please, if you have not gotten your vaccination, go and get one today. Those are the two things that I want you to remember this weekend. Masks stop the spread, vaccines protect. Thank you.
And I'll just add on to what both Dr. Walks and Adrian had to say, in that, as we start the month of September, which is National Preparedness Month, make a plan and prepare yourself. That includes self-care for you and your family, but be sure that you are masking and you have a plan to keep you socially distanced from people if you are exposing yourself unnecessarily. And definitely get vaccinated, because we know that works for everyone. And, we have a large group of people at Austin Public Health who have been working tirelessly since January of 2020 on COVID-19. And we want this to end as much as everyone else does. And so, again, it's about self-care. Take care of yourself. This is grating and wearing on a lot of people, and we don't want to have to work the extra long hours. We want to be able to enjoy our Labor Day weekend. Unfortunately, we have people that are going to be working through the Labor Day holiday to continue to investigate these cases of disease. And so as you go out and celebrate the holiday with your family and friends, stay safe and mask up, Austin. Thanks.
And I'll just close us out with, again, we have the tools and everyone has the resources to protect themselves. If you are needing a vaccine or if you have a loved one who needs a vaccine, there are many, many locations available. Many of the pharmacies, HEB, grocery stores have vaccine available. Also, public health has vaccine available. So this is an opportunity to make the most of your weekend. You've got 3 days to get that done. And just make sure that you have that layer of protection and you can have more confidence. And as you go about your daily life, that you have that layer of protection, as well as layering in the masking, the social distancing, the hand washing, all of those other protections that we know that we can do to protect ourselves from this virus. And with that, I wish you a great weekend and hope that everyone has a healthy and safe holiday.
That concludes our media availability for today. Thank you to Dr. Desmar Walks, Interim APH Director Adrian Stirrup, Chief Epidemiologist Janet Pichette, Cassandra De Leon, APH Chief Administrative Officer for Disease Prevention, Health Promotion Division, and to our pool reporter, Cara May Hernandez from Univision. Thanks for joining us. Have a safe weekend.